we've talked about this a lot, in my practice as well, that I've seen consistent results. Attention, focusing, environmental awareness, that language, both expressive and receptive. And I know you've talked about that before. What in describing this to parents, are there three, four things that you really would get across, those parents out there who are considering this therapy, what they should really think about with respects to B12, and really why they would want to do it?
Well, I think the most important thing that a parent would want to know is methyl-B12 works. It'll work for the majority of patients or children if the parents follow certain basic guidelines. I know Dr. Wooler follows the guidelines. Basically, methyl-B12 has to be a certain concentration, very, very concentrated so it comes out slowly. That way you can do fewer shots. The best way to do it is a subcutaneous injection. There are other ways it can be taken, but they don't work as well. And parents basically want to have something that, if it works, to give them the greatest intensity, not just that it works. So that needs to be done. Reputable pharmacies that have the right kind of pH and all really matters. So we need to be able to use it in injectable form. It needs to be a certain concentration. We need to make sure pH is correct with that. And it needs to be done with somebody who can let the parents know how to follow the results. And in my practice, when a person comes to me, I don't let them make any changes for 6 weeks. I can sacrifice 6 weeks when they come to me and to make no other changes, just do methyl-B12, the injections once every 3 days. And when they do that, they're able to see and know for sure that this is the reason the child is having the benefit. Again, I don't let them start anything else or take anything else away. All they do is methyl-B12 for 6 weeks. And then they're able to see it, and it allows them to have the longevity to go forward, because methyl-B12 will work to the most people just to a mild degree initially, but if you keep doing it long enough, it continues to work over time, just like going to school. To go to school 12 years is better than to go to school 8 years, and that's how it works here. It continues to grow. You don't need to do it forever. 2.5 to 4 years is what I would consider, before you get your methyl-B12 diploma and can get out of methyl-B12 school. So that's that kind of works there. And another thing, parents sometimes want too much too soon. What happens is we give the methyl-B12, and when you give it, it's only going to do so much. It's like giving a tulip or a seed or a tree seed. In 6 weeks, you're not going to have a beautiful tulip sitting on your countertop, and you're not going to be sitting under the shade of the tree. It doesn't happen that way, but it's allowed everything to start. And also what happens is we feel the acceleration of anything like like methyl-B12 or hyperbaric or these kind of things that work quickly. We'll feel the acceleration, and then once we reach the maximum speed, we don't feel it anymore, and then parents say, oh, I don't think something's working anymore. And again, in this case, methyl-B12, so they'll stop doing it. Rather, it's like I stop school after I don't, after I get used to it, you know what I mean? So what happens is if a person keeps doing it, you don't take the puzzle piece out of a puzzle to be able to build get the puzzle perfect. So what we do is we teach the parents to keep doing it. Again, an accelerator, if you take a Ford and an Indy 500 car, and if you accelerate with methyl-B12 gas, once the accelerator hits the floor, you can't make a Ford go faster, and you can't make an Indy 500 car go faster. They each have their own speeds, but they are still making the trip. And that's what we have to do. Consistency is very important, and persistence. So the most important thing is for 6 weeks to make sure it really works. And it's not going to stop working then. It needs to be continued at least for probably 2.5 to 4 years.